Hi, my name is Krista, and the title of this poster is Music Therapy as Complementary Intervention for Post-Surgical Pain. The clinical nursing problem that we're dealing with here is reports of unrelieved high pain levels from surgical patients despite analgesia. There is a substantial need for nurses to use evidence-based practice in controlling post-surgical pain and also educate patients on the benefits of music therapy for post-surgical pain adjunct to pain medication or analgesia. The significance of this problem is that 40 to 50% of post-surgical patients are reporting uncontrolled or less than ideal pain levels after surgery. This is a problem. Also, uncontrolled pain has a high potential for health issues. We all know that. Things like atelectasis and pneumonia happen when patients don't want to move due to uncontrolled pain. Also, decreasing physical therapy because patients don't want to move is another side effect of uncontrolled pain. The purpose of this project was just to reinforce knowledge about music therapy for post-surgical pain or introduce nurses to the fact that there is a high volume of research that suggests music therapy for post-surgical pain is beneficial in addition to analgesia. There were 8 research studies used in this project, and one similarity between all of the quantitative studies, was that the visual analog scale was used. There were 2 authors that did not use the visual analog scale, and that was Komiaks and Moses and Ozer's article, and these 2 authors used a 4-point Likert scale. Ozer and Bajoki were the only authors to cite an article that gave a detailed account of the origin of the scales used to measure pain and discuss the reliability and validity of those tools. The only study in this review to give the theoretical framework for the study was Komiaks and Moses. All of the studies focus on adult post-surgical patients, with the exception of one study written by Kleebler and Adamek, and this author used participants aged 13 to 18. The different types of surgeries included in all of the studies combined were made up of many different surgeries, and those included surgeries for hematology and oncology patients, coronary artery bypass graft or CABG patients, spinal fusions, elective cesarean section, open abdominal surgery, and solid organ transplant surgeries. Each study had a varying exposure to music therapy. This exposure ranged from a one-time dose of a 15-minute music session to 30 minutes of music therapy every single day until discharge. It would be beneficial in the future to determine if more or less therapy helps analgesia or post-surgical pain, because there was no uniform, consistent exposure to music therapy in any of the studies. This project was implemented on 3 South in the break room at 7:30 in the morning. There was a cover letter passed around to let the participants know of the risks and benefits of being a participant in this project, and also to let them know they could leave at any time. There was a 15-minute PowerPoint presentation, and after the presentation there were 3 questions, and during the proposal of those 3 questions, the floor was open to any participants to share stories or answer the questions, and they certainly did. Based on observant behavior, the high volume of answers, head nodding, and stories shared, I do feel this project was successful and that the plan change was highly accepted. Of course, there are changes to be needed, whether this exact study were to be implemented again, or if this study were to be fully implemented. Holding the meeting at 7:30 in the morning was not the best time for the participants. My entire participant population was made up of night shift nurses because the day shift nurses were not able to come based on patient demand. Holding multiple meetings during the week so that nurses can come would be beneficial. I would also like to provide an incentive, breakfast or lunch, just to provide an extra incentive in addition to increased nursing knowledge of music therapy for pain. I would also like this to be in a more formal setting. I think this would add to the delivery of the presentation. One big strength of this presentation was that the floor was open at any time for the nurses to share stories or answer any questions. I hope that this presentation was informative. Thank you for watching.